COVID-19 and the coronavirus by screening people who are coming into Zambia. So once again, government wishes to extend its gratitude because these people are also at risk, and just like any of us, they are quite concerned about the coronavirus. Number two, just to state that every time government wishes to issue a statement on this matter through the Minister of Health, there will be a press briefing such as this one. So anything else circulating on social media that is not as a result of a meeting such as this one is fake, like we saw the one that was circulating last night and up to this morning. Unless it is after a press briefing such as this one, when an official statement will be posted online, anything else is fake. The last press briefing we had was on Saturday. The second one is this one. So anything in between purporting to be a statement by the Minister of Health is actually fake and should be ignored. I think now the Minister of Health will go straight into the latest statement.
Thank you very much. Colleagues, I recognize the presence of colleague ministers from Office of the Vice President, Honorable Oli Papiri, the Minister of Information and Broadcasting, Honorable Doris Leah, Minister of Higher Education, Honorable Brian Mushimba, Minister of General Education, Honorable David Mawumba. I recognize the presence of permanent secretaries from the Ministries of Health, Ministry of Education, and all senior government officials present, and our friends from the press. To all of you, I say good morning and welcome to this briefing. Let me give special recognition to a guru of public health in Zambia, a teacher of many, and a public health expert of international repute, Professor Babu. It's good to have you in this press briefing. It does show that you're very concerned about public health. Right. So there's no projection. There's no camera. There's no PA system, right?
This is a live camera. It's your live.
Right. Our friends from the press, thank you so much for coming through to attend this press briefing. And through you, we are privileged to address the nation on the latest on the coronavirus outbreak, the pandemic that has been declared by the World Health Organization. The government of the Republic of Zambia, led by His Excellency Dr. Edgar Chagwa Lungu, has expressed grave concern at the imminent outbreak of the COVID-19 virus in Zambia, and has been proactive in coming up with measures to ensure that the Zambian citizens are protected from a possible outbreak, and also that preparedness is enhanced. And to show proactivity, His Excellency the President of the Republic of Zambia has directed further measures to enhance protection of the Zambian public from a possible outbreak, and also to enhance preparedness in the event that we got a few cases. Let me begin by giving a little background that the COVID-19 outbreak has now spread to at least 162 countries and territories, and the World Health Organization has now defined this as a pandemic. As of today, 17th March 2020, the world has recorded 181,335 cases and a total of 7,130 deaths. This shows a daily increase of 10,000 cases. Of concern to us is the rapid geographical spread globally and also in Africa. Since the first case was recorded in February 2020 in Africa, numbers have escalated to 322, and we've so far recorded 10 deaths in Africa. Zambia has not yet confirmed any case, has not yet recorded any case of COVID-19, but continues to pitch public health security as a very high priority. We now have escalated the level of preparedness to the highest and put in place intense measures to ensure that we're able to prevent new cases, first cases, and also to be able to respond to any possible outbreak. I'll now go through the new measures that have been directed by the government of the Republic of Zambia under His Excellency Dr. Edgar Chagwa Lungu. One, the screening process that is coordinated by our disease surveillance technical arm, the Zambia National Public Health Institute, mandatory at all entry points and has even become more rigorous. And for individuals or travelers coming from places where they've recorded cases, the intensity of screening has been increased. Statutory Instruments 21 of 2020, which designates COVID-19 as a notifiable disease, has been signed, and Statutory Instrument 22 of 2020, which provides additional regulations, has been signed, and this will facilitate management and control of COVID-19. These were issued on March 14, and I would like to emphasize that Statutory Instrument 22 emphasizes mandatory screening and quarantine of international travelers, including air travel passengers, truckers, bus operators, and passengers at all ports of entry for 14 days. And this quarantine shall be enforced by our public health officers, and there shall be regular follow-ups of all people under quarantine. I must emphasize that for all citizens returning home from countries that have been hit by the COVID-19 outbreak, they shall be quarantined. If they are asymptomatic, they shall be in self-quarantine, and the regulations for self-quarantine will be made extremely clear. Put simply, you will be restricted to your home state, and even when you're restricted to your home state, you should be restricted to rooms where there is minimal contact with the rest of family members to avoid possible spread should you become symptomatic. You will be in contact with our public health officials for 14 days until we are confident that the 2 to 14-day incubation period is passed. So I emphasize that international travelers from high-risk countries, citizens returning home from countries that have recorded COVID-19 shall be in self-quarantine if they are asymptomatic. If they are symptomatic, they will immediately be isolated in designated places where we have highly trained rapid responders who will ensure that symptomatic management or treatment is instituted immediately. And these places have been identified in Lusaka, on the Copper Belt, in Livingstone, in Chisali, and in Petauke. We are engaging all our district health staff along the border areas and in all parts of the country to ensure that we have adequate numbers of rapid responders. Let me also emphasize that for the community, if you come across anyone with symptoms, it is mandatory to report. Even for those people who have not been in self-quarantine, should they develop symptoms, report to the health authorities. There are toll-free numbers that have been circulated to avoid contact with fellow passengers on public transport, with many other people you may meet in transit. It is important to pick up a call when there are symptoms so that authorities can mobilize and ensure you are transported swiftly and to the appropriate places where help shall be found. Even if you did not travel and you develop the symptoms, kindly engage with our health authorities. We are emphasizing again the restriction on all foreign travel, and the public is advised to reschedule all avoidable travel. We further emphasize that hygiene practices to promote infection prevention in all passenger vehicles, aeroplanes, marine transport, and other conveyances must be enhanced. Government has further engaged with airlines and introduced pre-departure screening. Pre-departure screening has been introduced in conjunction with all the airlines that fly into Zambia. Further, all missions abroad, Zambian missions abroad, will review the visas that have been issued to would-be travelers from COVID-19 high-risk countries. And like I said, pre-departure screening, not only for passengers coming from high-risk countries, but all those transiting through high-risk countries. COVID-19 high-risk countries has also been introduced. I would like to emphasize to the public that the two known high-impact interventions that promote prevention is hand washing and general hygiene. So the President, through the Keep Zambia Clean campaign, has ordered a scale-up of cleaning up of cities and communities. The Ministry of Health and all the line ministries will continue to engage to ensure that these measures are implemented. We further want to emphasize that engagement with various community leaders is ongoing, chiefs, religious leaders, and we want to place on record our appreciation to the religious leaders who have responded very quickly by putting in measures to prevent coronavirus spread. One, we want to appreciate the introduction of hand-washing facilities and the reduction of hours which they congregate. Ladies and gentlemen, as you've seen up in front here, I've been joined by the Ministers of Higher Education and the Minister and General Education. In order to ensure minimum spread of COVID-19 in the event of the first few cases, and to further demonstrate government's concern to school children, and in escalating the response in preventing COVID-19 outbreak, all schools, colleges, and universities will close this Friday. All schools, colleges, and universities will close this Friday. And between now and this Friday, we will be disseminating information to our students, to our pupils, on how to prevent transmission of COVID-19 in the event we had initial cases in the country. And also, we will be engaging our various stakeholders in these institutions of higher learning and general education to ensure that we empower, through them, we empower the communities where they're coming from with information to ensure prevention and minimize transmission in the event this happened. This just brings forward the recess for these institutions. And as the epidemic evolves, we will be giving guidance on the reopening of these institutions. We'd like to emphasize that a multi-sectoral approach will be adopted, will continue to be adopted and implemented. And following the setup of the Emergency Response Fund of 57 million kwacha from government treasury, many stakeholders, many cooperating partners have come on board to support the activities of COVID-19 emergency response. Members of the press, ladies and gentlemen, countrymen and women, I'd like to reiterate the message from the Minister of Information. Misinformation will mess up the response. Let us heed that call and avoid misinformation. As the Minister of Information has stated, you will see us issue press statements on camera, and these press statements will be distributed to the press. Any other sources of information should be discarded. A call center has been established for the public to report concerns and also receive information on the disease. The dedicated call centers have been displayed in various parts of the country and in your various places of work. Let us re-emphasize the importance of hand hygiene, the importance of hygiene in our communities. Let us comply with health inspectors and authorized officers who will from time to time visit public places to ensure compliance. Failure to comply will constitute an offense. Distinguished ladies and gentlemen, we will be giving regular updates to the nation through you, the media, as the epidemic evolves, and decisions may change depending on how the epidemic evolves. When you have any queries or questions, feel free to contact our technical people at the call center. The command center remains the Zambia National Public Health Institute, where an emergency operating center has been established and where a plan has been laid out for prevention and for response to the imminent COVID-19 outbreak. We thank you for coming. Thank you for attending this press briefing.
Maybe invite your minister and your colleagues to call their questions. They will. Would you like to say something
Okay,
before?
you can have questions, you can ask questions, and my colleagues here from the education and higher education are available to take questions. I don't have anything to say.
Okay, I can leave.
So thank you so much. The guidance has been given, so we will take questions. We will ask as many questions as you could. So what I would request for you that we'll have three questions each. So introduce yourself, the media platform you're coming from, and then one question. One question. There are not doing one. Okay, so I have the first three ladies there. Start with Where you're coming from.
My question is on street vending. We say that street vending has continued, and sometimes these street vendors sell fresh foods like meat and other things. What is the ministry doing about this? Thank you.
Thank you. Number?
We know that for more the day for more has been announced, which is the 4th of I'm asking in relation with Pomoka ceremony, which is scheduled for 4th of April 2020. What is the ministry's guidance on that ceremony, which we all know that it's My name is Violet Moses from Zambia Daily Life. The minister spoke of training the health personnel. I'd like to find out how many health professionals have been trained in this specific pandemic, and also the number of isolation centers that we have countrywide. We are not trained.
So now to take two more. Yes, Then the last one, thank you about that. Before we give our honorable ministers.
My name is Head of Scars representing MPC. I just wanted clarity on the recess of schools. I think I can get the point. For how long will this be?
Questions?
We can take a few more. I saw a hand here.
My name is Simon from the Daily Nation. You mentioned about the public schools to do the meeting. My question is that how about these other education venues? Or for example, let me just say that the bars. Any intention of closing these bars?
Thank you so much. Honorable ministers, those were the questions. One was street vending, one was on the Mboka ceremony, and then how many personnel, and then the suspected cases in Ndola, the recess of schools. I'm sure honorable ministers from education will answer that. And then another one with the testing breakfast. What is it that we're doing about it? Street vending. Question came up, and then travelers. There's two people traveling, so those are the questions.
Well, thank you very much. Again, would like to emphasize that these measures were proactively taken just when the threat of the COVID-19 outbreak arose. And what we are doing today, in order to respond to most of your questions, is to emphasize the measures that in escalating our response, the President of the Republic of Zambia, Dr. Edgar Chagulunga, has directed. I'd like to emphasize, colleagues, that Zambian missions abroad have been directed to review visa applications for would-be travelers to Zambia. At the same time, foreign travel to Zambia, to high-risk countries, we're saying should be postponed. At the same time, for those who are coming to Zambia, pre-departure screening has been intensified. At the same time, for those who are transiting in countries which are high risk for COVID-19, those are equally being screened. And we are saying we're working closely with airlines to ensure that there is minimized risk of foreign travelers coming into the country from high-risk countries. I would like to emphasize again that schools and training, high institutions of learning will close on the 20th of March, Friday, this week, in order to protect the public. These are the escalated measures that have been put in place in order to protect the public, in line with guidance from the Republican President. Colleagues, having said that, some of the issues that do not come out of these questions that you've asked, we've trained 580 health workers countrywide as rapid responders. And these are not only doing surveillance and disease intelligence, but these are ready in various facilities. They are ready in various facilities to treat symptomatically, to resuscitate, or to manage within the guidelines that have been provided any possible new cases. We've rearranged our ports of entry in terms of port health services surveillance to ensure that screening is intensified. For buses coming from South Africa, coming from outside the country, we'd like to thank Lusaka City Council for working closely with a partner and having identified a different port where these buses will dock. Buses that are coming from outside Zambia will not dock at the intercity. They will dock at the dry port, and I'll be asking His Worship the Mayor to say a few words on that. This is to ensure that we screen thoroughly passengers that are coming from outside the country using bus transport. So there is a dry port that has been opened up as the docking area for buses that are coming from outside the country. Isolation centers have been identified in various parts of the country. We have mapped our assets that we require for management of cases along the continuum of care. There are cases that will need tertiary level care and that will require ventilation. And so we've identified which hospitals such facilities will be provided. Today, we have Tubalenge with a bed capacity of 20, and should we need ventilation, we will move to a designated unit within the investigating hospital where there are ventilators. And should the cases swell, we have even a bigger facility at the new wing of Levi Manawasa Hospital. Ndola will be the center for the Copperbelt region. We have introduced another center in Luapula in Mansa and in Livingston at Livingston Central Hospital. And for those coming through Nakonde and generally for cases within that region, Chisali General Hospital is the area. For Eastern Province, Petauke General Hospital is the place where we have adequate facilities in the event we need to scale up clinical management. Must emphasize that most cases are mild and require simple symptomatic management and do recover. For the elderly and the immunocompromised, a number of cases do progress to severe disease, which may result in renal failure, and that may result in complications in our cardiorespiratory system and may require ventilation. And so the cases will manage in those designated places. But be rest assured that the whole country has designated isolation facilities, and we have stockpiled PPEs, to personal protective equipment, to ensure that we respond appropriately. Invoking the Public Health Act to bring in measures to protect the public from getting the disease requires restrictions on public gatherings. Restrictions on public gatherings. Zambia has not recorded a case, and the response is scalable. And where we are today, we are restricting. We are working with our colleagues in the local government to ensure that, one, we don't have unnecessary gatherings. So bars will not operate beyond the hours that have been designated, and public health inspectors will ensure that regulations are adhered to. And like I said, measures will be escalated depending on the epidemic. We have restricted hours of operation for places where the public gather, everywhere, including churches. We have restricted the number of hours that they can meet, and then there are measures that have been directed such as hand washing and general hygiene. And if our health inspectors visit these public places and they depict that there's little compliance to the measures that have been put in place, those facilities will be shut immediately. There's been information that Ndola has recorded a case. I want to emphasize again that when you hear that there is a suspected case or an alert, it is because our surveillance system is sensitive and it will pick up cases as they come. But when we're investigating an alert, we are not confirming a case. Should a case come out positive, we will issue a statement in the manner that we're issuing this update. So there is no confirmed case of COVID-19 in Ndola. Zambia has so far investigated 28 alerts, and all these have come out negative. There is perception out there in some quarters that we have not recorded positives because we are not testing. Zambia has intrinsic capacity to test for COVID-19, and we are screening people, and those that require testing are being tested. And so far we investigated 28 alerts and they are all negative. We've been testing at the virology lab at UTH, at the veterinary lab at the University of Zambia, and we have capacity to test. We have algorithms that give us the indication to do such tests. So our alert surveillance system has picked out 28 alerts, and these have been investigated. They do not constitute a case definition for COVID-19. So Ndola has no case of COVID-19. Should there be a case in any part of the country, we will summon the press, and through the press inform the nation, and also, like I said earlier on, scale up our interventions. Be rest assured that we are in constant touch with all the districts. We have an echo platform where we engage with our district staff, provincial staff, every day, where we discuss surveillance and disease intelligence activities. We have engaged with various organizers of events, and will continue to do so, and we are advising as such, and appropriate announcements shall be made from relevant authorities pertaining to such events. As for us, we are giving what is mandated to be done in such a time when the threat to public health is grave. The schools, like we said, will close on March 20th, and the date of opening will be determined as the epidemic evolves.
Thank you so much.
Last time? Protocol tells me so. Thank you, the Honorable Minister of Health. Thank you for giving me this opportunity to be very brief. I recognize your presence, sir. Dr. Chilufya, the Minister in the Vice President's office and also in charge of DMMU, Honorable Olipa Piri on my left, the Minister of Higher Education, Honorable Brian Mushimba, the Minister of General Education, Honorable David Magumba, the DMMU coordinator, Mr. Chandakawe, and indeed the PS of Ministry of Health, our host, Dr. Malama. Quickly, the minister has announced that buses coming outside of Zambia that land at intercity bus terminals in Lusaka. This includes, and more so from countries where coronavirus has been detected, be it by one patient And this includes South Africa on the south, and on the east side, Tanzania and Kenya. We have on a daily basis about almost 10 buses from south going and coming, and this side also. So decision has been made with immediate effect. All buses that are going to go outside in those direction and coming, they will not dock at Intercity. We have secured a place, as announced by the Minister of Health, Dr. Chirufya, the old dry port on Kafue Road. After Cosmopolitan Mall, you keep driving, and before Andrews Motel on the left, it used to be used back in the day as a backup for ZRA, for trucks at Chirundu border, because the convoy and causing congestion then. So back in the day, they would allow them to drive all the way to Lusaka and then dock there until the ZRA process is completed. But then, so the owner of that place, who I want to sincerely thank now, before then, since the minister's press conference and the government spokesperson on Saturday, we took from their guidance and were looking for an option. The only way was to move those international buses going into Intercity, because we have others coming from all the provinces. So if one came, they were all exposed. So we were thinking of Independence Stadium, then we thought DMMU might want it, because in case of isolation, or God forbid we get one breakout, that would be a place that is conducive for their purposes. So the owner of Lamasat, the chairman of Lamasat, Mr. Muhammad Ahmed, has given us his dry port land. It's a vast land that he can immediately start to use. We said, oh, we'll give you a payment for your land. He said, no, for Corona, I'm giving it free for your use, for the benefit of the city and the benefit of the country. So I wish to thank Chairman of Lamasat for this gesture to Lusaka City Council and the people of Lusaka and the Ministry of Health and the country in general, and the President as well, because we all report into the President. So Intercity, the buses that go, I wish to alert them. I have them here, there are 6. They should immediately make alternative arrangements. These buses are Shalom bus, they go to south, Unlimited Gift bus, Jordan Motors bus goes to South Africa daily, Power Tools goes to South Africa daily, Royal Africa bus goes to South Africa daily, some of these go to Tanzania, Dar es Salaam. Eloi bus also travels either to Tanzania or Dar es Salaam. We are cognizant of the complaints that just stopping those buses coming, it may affect the people who trade the SMEs, about Makwevo, who travel to and from those countries to bring goods for resale for them to feed their families. So we are having to juggle. Before we could decree or convince the minister to decree that I think we should close the borders so that those buses don't enter Lusaka. So for now we have an immediate solution. We've already given orders. The buses coming from south, they will not enter Intercity. They will be received at the dry port. Thank you to Muhammad Ahmed and other cooperating partners to come in with their social corporate responsibility, CSR, and don't wait to be asked. Come in and see how you can help us with this potential pandemic. Thank God there is 0 reports in the country. Honorable Minister, thank you for this opportunity.
Well, thank you very much. PS Kaku, could you introduce the other donor who is donating to this fund, please?
News on the go with Diamond TV, powered by MTN.
I always look forward to Sunday lunch.
You're gonna need some fruit top to wash all that down.
And nobody does Sunday lunch like my mom.
Hey, Chris! Hey, Jack, come over! Mom, can Jack come, please? Wow, is that fruit top?
Nothing in this world is better than chilling at home with everyone. Woke up this morning with sunshine in my eyes, telling me everything will be fine. Lomba tintuti kudu chibozi, banjalo zelazi pesa pamozi. Doesn't matter where you're from, you cannot beat the taste of home.
And the thing I like about Sunday lunch is that everyone comes together.
There's no taste like home. There is no better feeling than knowing that this is home. There's no taste like home.
Nothing brings a family together like a good meal and a great drink. Introducing Fruit Top, orange, pineapple and granadilla fruit squash. Fruit Top, with the real fruit in every drop.
Welcome to MBET. Join our community of fun and lucky winners. It's easy. Play just from your smartphone by downloading our app or directly on the web 24/7. Enjoy and bet on top-level football competitions, more sports, perfect 12 daily jackpot, live betting and quick lotto. Pay easy. MBET. Get your bonus on www.m-bet.com/ZM. Pay easily with MTN Mobile Money, Airtel Money, and Zamtel Kwacha.
Are getting good feedback from the leadership of markets and leadership of the street vendors. But let me just make a clarion call to all businessmen, be it street vendors, be it marketeers, be it bar owners, to please adhere to the provisions of the statutory instrument. Failure to adhere to the provision of statutory instrument shall attract penalties that will include shutdown.
Thank you. I recognize my fellow ministers sitting here and the PSCs, senior government officials. I thought I would take this opportunity also just to speak a little bit on the higher education side and what this announcement by the minister and by government does to us, especially as it relates to some of the issues lately that have been picked up in the institutions of higher learning, such as ghost laws. A lot of you media houses have been calling me, that colleges, the lecturers had gone on ghost law, University of Zambia and CBU, and such. But before I speak to that, there were a lot of concerns that were coming through to my office from parents, from university administrators, college administrators, trying to ask government for its position in as far as COVID-19 is concerned and the large numbers of students that they have. And this I share with Minister of General Education. He probably equally has as many students as we do in higher education. And we were concerned and we were taking this alarm that was coming to our ministry as parents and as administrators were reaching out to us for guidance. And today what government is providing is a guidance that they were looking for to minimize any potential outbreak, because if we had an outbreak of this and it entered in one of our universities or colleges, you would see just the sheer impact it would have. And as a proactive government to make sure that we protect our children, we protect our students, this decision has been made today. But there may be some circles that may say, well, you also have not paid some of the lecturers. And what does this mean? And I want to speak to this, that for the universities, their March grant, which normally would have come around 6th to 10th March, which has delayed up to now, will be paid before the universities close. Colleges, last week, government released funding to TVET institutions. This funding has been received already. And if there's any top-up that government needs to release to them before closure of colleges, that also government has committed to do it, so that we close on a good note and we manage this COVID-19 pandemic appropriately and don't expose our children, our students unnecessarily. This is a required and necessary intervention by government to make sure that those places of high concentration of people can start to disengage and they can stay home as we get through this situation. Thank you.
Thank you, Minister, and I recognize the presence of my colleagues, cabinet ministers, His Worship the Mayor of Lusaka, PS Kabwe and PS Dr. Malama, PS Kapa and other PSs. I don't know where my PS is sitting. Just to re-emphasize what the Minister of Health has said, the decision to close schools is a very difficult decision. You can even see all over the world, some of the countries are still struggling. They haven't closed the schools despite having very good public health systems in place, because largely it is a very difficult decision. For me, I just want, through the advice of the Minister of Health, to thank the President of the Republic of Zambia, because he recognizes that the wealth and safety of our children in our school is paramount. So this opportunity we are giving them to close on the 20th of March is to ensure that the pupils, especially look at children, early education, maybe some of them 4, 3, 5 years, how do they take care of their own health? So it's important that the schools close, and therefore the children are in the hands of their parents, and PS Rwanda would be in the shortest time be guiding our provincial education officers in terms of how this transition up to the 20th of March is going to be. So with that said, I just want to thank our colleagues from Ministry of Health, and we will continue collaborating with them in a more sectoral approach. And the opening of the schools would be dependent on the advice that is going to be provided at the appropriate time by Ministry of Health. So Dr. Shufia, thank you.
Thank you very much. We're ready to take some more questions. Any more questions? Yes, ma'am.
We get some more questions. That one has been answered already. So there's one. Tambula, you asked to ask. Okay, so we'll start with you, madam. So your name?
Is there any measure you're going to put e-learning for the
Thank you so much.
Fear me if you will.
Good morning, Honorable Minister. I don't know if you can see me here. I'm overshadowed by the camera.
You know your voice.
My name is Andrea. I write from Southern Times. Honorable Minister, I just wanted you to expand on the issue of religious or religion-based kind on how long people should congregate. I know people congregate for different hours, so maybe you can clarify what's the way forward. And also on the humanity aspect, those that be bereaved during this period, how long can they congregate?
Thank you so much.
Honorable, I just want to get your perspective regarding an update regarding the development of a vaccine on the coronavirus. Then I also want to find out places like prisons, which are usually we have the aspect of congestion. What sort of interventions are being recommended?
Thank you so much for breaking the rules of all customers lesson. Can I have another?
MCC.
Okay. We are ready for
Of course, what about MCC?
I can allow you number.
We are not direct.
There was a question which was asked about sporting activities. I know that everybody had to, and the regulations also for the association. Can you give us answer that?
Honorable Ministers, I know that the Honorable Minister of Health has directed that to restrict the hours that we can. So I request that the Honorables would answer that.
Well, thank you very much. I did not avoid the question on Kwamboka, but I said organizers of public events are liaising with us so that we can guide on the way forward based on the statutory instruments that we've issued. But we will not be qualified to start announcing specifics about specific traditional ceremonies because there are authorities that do that. Our role is to ensure that we protect all citizens from the threat of a public health nature, in this case the COVID-19. So all organizers of events are engaging with us and we are guiding appropriately, and appropriate announcements shall be made from the appropriate authorities. Nambula, as a Lozi chick, I expect you to understand that clearly. Yeah. The issue of churches, we've made it very clear that the provisions of the statutory instrument will apply consistently to all congregate settings. There shall be reduced hours and there shall be hand washing facilities and there shall be no handshakes and there shall be social distancing and there shall be barriers between people who are coughing or exhibit any form of a symptom. And we shall continue to engage every stakeholder to ensure that in whatever they do not promote transmission. Our colleagues in various ministries, in the true spirit of a multi-sectoral approach and a one government approach, we will do specific announcements and measures. They'll implement specific measures that are in line with the statutory instrument. So we expect that bars will comply to the measures that have been announced within the SI, and our colleagues in local government will ensure enforcement. And already they are swung into action. We have made appeals to religious groupings, and I must place on record our appreciation for the quick response from many, many religious groupings, the Catholic Church, the Apostolic Faith, the SDA, and many Pentecostal churches that ran key messages last weekend and that reduced the numbers of hours of congregating and that ensured there were hand washing facilities where they are. This is as it should be. The question about people having gatherings, whether they're elections, football matches, and so on and so forth, is answered by the statement that we will be consistent in the application of the statutory instrument when it comes to all congregate settings. Where there are mass gatherings, we will discourage. Where there should be some gathering of any nature, we will guide how that should be. So we are encouraging anyone with events to engage with us to ensure that we can provide guidance. But we are categorical. We are restricting public gatherings. Is there a vaccine that is available? Well, research is ongoing, and as we speak, there's no treatment, definitive treatment, and there's no vaccine available, but work is ongoing. And what we're doing for cases that are confirmed is symptomatic management. I'll leave my colleagues to speak about the issue of e-learning and many other issues to do with education.
Thank you, Minister. To answer the questions on what Baobab and other international schools they've done, I'm sure as you're aware, education technology and the school digitalization in terms of infrastructure platform is very minimal in the country. So obviously there will be very few schools that will have that platform, because that particular platform entails either a child having a smartphone or having a computer at home. However, and this is why in my comments that I gave earlier on, I did indicate that PS Rwanda is going to guide our provincial education officers in terms of the learning protocols that is going to evolve during the project of the schools. One of them during the transition would be to ensure that as students go back home, they are given sufficient homework and reading material by the teachers. Number two, some of you may be aware that the Ministry of General Education has got what we call the Education Broadcasting Service. So again, PS Rwanda is going to guide the POs on how the Education Broadcasting Services during the closure of the school is going to be used as a tool for learning, including our radio services. So I'm sure even with this closure, there are other strategic interventions that government will put in place to ensure that children are not behind. Thanks so much.
Transmission of COVID-19 is by droplet infection. Is by droplet. You know, you cough out, and you're infected, and you cough out, and in the droplet there's the virus, and someone within a meter inhales it and gets the infection. That is how you get it. So human-to-human transmission is through droplet infection, and we are going to advise what measures to put in place. So far, we've advised hand washing, hygiene, social distancing. Those are the key, measures. We would like to ensure business carries on normally, but within the provisions of the statutory instrument and within the broader public health rules. And so, we are not giving bans, on any of, specific, businesses, and we're just emphasizing adhere to the rules as laid out in the statutory instrument, and we'll be good to go. All of us are safer if we promoted hand hygiene and if we promoted general cleanliness in our environments, and if those who have a flu or a cough create a barrier between themselves and the next person by covering their mouth and nose when they're coughing.
Or staying home.
Or staying home. Yeah, and social distancing, extremely important. And so let us promote prevention. Let us ensure that you, the media, promote awareness, sensitization of the public, because early detection will be key to the outcome, of these, cases. As the media are still gathering courage to ask more questions, Honorable Minister from the OVP.
Thank you so much. First, I would like to thank you for affording me this chance to talk to the media and recognize the presence of the Minister of Higher Education, the Minister of Higher General Education, the Mayor of Lusaka, the NC, the National Coordinator for DMMU, the PSS for Health and Education. As the Minister in the Office of the Vice President, we are there to coordinate and work together with all ministries so that as we are facing all these challenges which are coming in front of us, as the ministry in the office of the Vice President, we make sure that we sit with the ministries and make sure that everything it is coordinated well. And also, we are also coordinating with the market supervisors who are the market managers, so that all those people in the district, as you have talked about, also ministry under the Vice President, we are there to coordinate with them so that they do the sensitization. While whatever sector, that office is free. And we have also come up with the call center under GMMU, whereby all those queries, and if there is any outbreak somewhere else, people should be alerted by using our call center at GMMU. Thank you so much.
Thank you so much, Honorable Minister. Seeing that we are seeing any hands, we may take the last round of questions. Parliament.
Yeah, we need to go. Let's build 10. Let's build 10.
We'll take the last round of questions. Our ministers have to be released. This parliament person, so they have to prepare. So we'll start with you, Madam, then we'll turn to the
my name is Kapula. I wanted to find out, Zambia is a landlocked country. And looking at the fact that we've seen some other countries that are more developed and have, the ability to curb the virus, have closed some of the borders. What measures are we taking as a country to ensure that the people that are coming in, or maybe we close the borders as well? I heard the mayor mention of the fact that we do have SMEs that we're putting into consideration because they've got a family to feed. But if those people come in with the virus from wherever they're going, their families will also be affected, which will bring in the disease, the virus in the country.
Thank you so much. There's the hand just below there. Yes, introduce yourself and your question.
My name is Patrick Nsakalimba. I'm the director of Cloud9 Offices Media. Just wanted to find out from the minister. For the past few months, I have been coming to the Ministry of Health to advocate for a platform that I've been introducing that would allow the Zambian people to be informed directly on their smartphones, like the way we send WhatsApp messages, but maintaining confidentiality, privacy, as well as official platforms. So I just wanted to find out from the minister if by any chance they have seen this MOU that I have delivered, but also to say, like, speaking from experience, this morning I was not familiar with this platform that was being brought to today. So I had to find out through different media, and I think the Zambian people also sometimes use these programs because we're not made aware beforehand. So the question is really to ask if, as we are pursuing all these different media, TV, if we're also looking at this platform to reach the different Zambian people right on their smartphone. So I just wanted to bring that to attention.
It should be the last hand. That's by the way. Okay. Yes.
Thank you very much. I'm Violet from Zambia Daily. The minister spoke highly about us maintaining a clean environment and hygiene, but I've noted with sadness that it's been very hard for the country as a whole to ensure that we have a clean environment. So to the minister and the mayor of Lusaka, what do you think is a lasting solution for Zambia to maintain a clean environment? Because if you just walk out and you find that we have so much dirt around us and we live with this dirt as though everything is okay, what's the lasting solution?
Okay. Thank you so much, honorable ministers, and I believe this was the mayor.
Thank you very much. In an epidemic, you review interventions as the epidemic evolves. The pandemic that has been declared by World Health Organization requires that countries come up with scalable plans. Now, we're privileged in Zambia that the political will at the summit has been very good. And His Excellency President Edgar Chagwa Lungu has led the charge from the front line, directing a multi-sectoral response and directing measures to protect the public from COVID-19. And like I said earlier on, while we have told our missions abroad to review visa applications from would-be travelers from high-risk countries, and while we have intensified pre-departure screening and screening for passengers in transit from COVID-19 high-risk countries, we are not, at this point of the epidemic, closing borders. We are not, at this point of the epidemic, banning flights. It's a scalable plan, and should there be need to scale up our response, one, it will be evidence-based, and two, it will be announced at an appropriate level and time. So for now, the interventions that we are doing are within what is acceptable by World Health Organization standards. Zambia has adopted a transformational agenda in which health systems are being reformed to include public health security, and all these being done in a multi-sectoral manner. And the complexion of the high table here demonstrates President Lungu's multi-sectoral approach, not only to development, but to health. Mr. Director there, thanks for using this opportunity to sneak in a question about your app and your business. Yeah, but well, thank you very much indeed. And what I would say is that technology is key to information dissemination, and the delivery of bulk messages or delivery of messages through specific platforms is something that we are embracing to enhance risk communication. Empowering the people with information through various platforms is the cornerstone of our response. So we would not refuse to work with people who mean well and people with good products. Yeah, and we'll be happy to work with you. Did I respond to other questions?
Yeah. Cleanliness.
Cleanliness, like I said, the President, in the spirit of keeping Zambia clean, has directed a scale-up in the clean-up operations of cities and communities wherever they are. So this is a directive to all citizens, municipalities, and other local authorities, including city councils, to ensure an upgrade in levels, a scale-up of hygiene in all places where they are coming from. Restricting visitations. We're restricting visitations to highly infectious places such as hospitals. We're also
News on the go with Diamond TV, powered by MTN.
Yeah, I just washed this.
Nalipate fiko ineshifaya fiko etombo fecha boom. Nizonda dotindie tamene nikondo seveze sabum. Makes your white much whiter. White school shirts and laundry. Your surface is sparkling brighter. Your number one tough stain fighter. Oh yeah, boom.
Introducing Boom Household Bleach, your new #1 bleach specifically formulated to bring out the whitest whites in your laundry, plus many more uses in your home.
Your #1 household bleach.
Boom Household Bleach.
Trade Kings, improving lives.
very closely with us to ensure that our people are protected from COVID-19. DFID, Global Funds, and the United Nations agencies are appreciated for the support that we are receiving. Would like to urge all corporate institutions, individuals to benchmark what Labasat and Zenith have done in contributing towards the emergency fund for the fight against COVID-19. Would like to thank you all for coming, and God bless. Good job. Thanks so much.
News on the go with Diamond TV, powered by MTN.
We're diving in deep this March, flexing our muscles to give you a great viewing experience. Let's do this. Put your big girl pants on and forge your own path.
This is the first check I've ever gotten.
How many people would kill to be a gram?
It's not all it's cracked up to be.
Hostile conditions, huh? Brush it off. Stay connected to GoTV for shows that will get you pumped up. We're going all in this March. GoTV, live it. Love it.
Woi, lero tukumwa tiboni zona. Woi, nisha ukanka mais. Nona njala ngala pa haidli. Monga ni kata tizeo. Nadao yo samba kumanja kulibe. Hygienic Spanish.
Imwe, contravening Cap 7 of hygiene laws. Mkudia so samba kumanja. Je hygiene ya branch.
Bad hygiene malpractice. Apa nomba diarrhea. Yala mixta assault pamala.
Sinzati majemzi ya manje sio kwala la monga ya kudala. That's why mfuko sambila na hygienic soap. Mabera you. Officer Pompi.
Go please, madam.
Go and hygienics and kurukuta them right now.
Hygienic soap is a powerful antibacterial soap with active sulfur technology formulated to kill 99.9% of germs.
Hygienic soap. You are safe in our hands.
Stay happier with DSTV's 2020. All you have to do is pay for your DSTV subscription and you get up to 42% discount. What's more, you get upgraded to the next package.
At one.
Just pay for your current package and get upgraded to the next package. With DSTV, even when times are tough, we got you.
For you, I can do anything.
Now, that's 2020. DSTV. Feel every moment. T's and C's apply.
For those school lunches, for that much-needed break at the office, or just to replenish your energy levels, for that all-day, everyday soothing refreshment, nothing beats the refreshing fruity milkiness of Shake and Sip Fruity Milk. Shake and Sip, when fresh meets fruity.
Trade Kings, improving lives.
Don't use extreme measures for good skin. Use MediHerb. MediHerb Ayurvedic soap combines the strength of 18 herbs to form the best defense against common skin conditions such as pimples, acne, rashes, and dry skin. Its natural ingredients make it safe for everyday use and is the best option to give you healthy and radiant skin. It's natural, it's fresh, it's MediHerb.
This could be you, or this could be you. Even though there are hundreds of road accidents every day, we have driven you with confidence, ensuring you reach your destination safely. From motor to home and property insurance, take up a Madison General Insurance policy today and secure your tomorrow. Madison General Insurance, safeguarding and giving you peace of mind since 1992. MGen. It's worth it.
Chelsea cookies, delicious cookies, the secret recipe to happiness. A little bit of chocolate for moments you won't forget, to make your masterpiece of tastiness. A little bit of butter makes life better, for memories to bring you happiness. And for you, Mr. Healthy, I have something nice and OT to keep you going nice and strong. Chelsea cookies, delicious cookies, baking delicious memories. Chelsea cookies, tasty cookies, baking delicious memories. Trade Kings, improving lives.
This one goes out to all our dreamers.
You are killing it.
The fearless, the ambitious, the lovable, the fierce, the hilarious, the fighters, the inspirational, the strong, the believers. Celebrate all our powerful women this International Women's Month with GoTV. We are for every woman. Yes! GoTV. Live it. Love it.
Can I have that meal over there? And I really want that crispy, fresh apple taste from the garden. Can I have happy apple?
I think I'll have my Big Bite 2 meal with happy waziwaka. Give us your
Enjoy an appetizing Big Bite meal with an happy drink of your choice. A meal is not a meal without an happy drink. And now introducing Happy in a can. News on the go with Diamond TV, powered by MTN.
Live from the Ministry of Health, where they have been given an update on the coronavirus and measures of prevention. One thing that has stood out today is that schools will be closed from Friday until further notice, till the Ministry of Health can be able to ascertain how the virus has prolonged and what other measures can be put in place. Colleges and public health institutions like hospitals have been restricted from inappropriate visits, of which the ministry has said that the minister will be the only one giving statements on the update of the coronavirus, and anything apart from the Ministry of Health press briefing should be taken as fake news. This has been Agnes Shamboko for Diamond News on the Go at the Ministry of Health.
News on the go with Diamond TV, powered by MTN.